Health service financing in Ghana. Kwame, a young and passionate health management consultant, was preparing to deliver a lecture on Ghana health service financing. He believed that understanding the evolution of healthcare financing from the historical roots to the current National Health Insurance Scheme (NHIS) was key to creating a future where quality healthcare is accessible to all. Determined to make his lecture engaging, Kwame embarked on a journey across Ghana to uncover the real-life stories behind the policies. Kwame's journey began at an international health conference in Accra. There he met Dr. Mensah, an expert on global healthcare financing, who explained that financing health systems globally relies on a mix of general taxation, social insurance, and out-of-pocket expenditure. Around the world, healthcare is funded in many ways. Dr. Mensah explained, in Ghana, our health service is financed by government funds, user fees, and support from partners like WHO, GCA, DANIDA, UNICEF, and DFID. Local philanthropic gestures also play a role. Kwame noted the challenges discussed: rising medical costs, increasing budget constraints, and the significant burden of out of pocket expenses. He realized that these issues were only global but also echoed at home in Ghana. In a quiet museum in Kumasi, Kwame met Miss Ajwa, a retired health administrator who guided him through Ghana's healthcare financing history. After independence in 1957, Ghana proudly offered free healthcare, she recalled. But as time passed, token fees were introduced in 1972, and by 1985, we shifted to the cash and carry system to recover about 15% of public sector operating costs. Ms. Ajwa explained that while the cash and carry system aimed to sustain the health sector, it led to major issues of financial access and equity, especially during expensive illness episodes. Although exemptions were later introduced for vulnerable groups, pregnant women, TB patients, and more, they proved difficult to implement, leading to growing public discontent and calls for a better alternative. The birth of NHIS. Next, Kwame attended a round table discussion hosted by veteran policymaker Mr. Kofi at the Ministry of Health. He learned how evidence, political will, donor influence, and international organizations coverage to birth the Ghana Health Insurance Program. Back in 2003, guided by Act 650 and LI 1809, were introduced the health insurance scheme as a pro-poor intervention. Mr. Kofi explained, this was later strengthened with the enactment of the NHI Act 2013, Act 852. The idea was to move away from the unaffordable cash and carry system to ensure that every Ghanaian had a sustainable and equitable way to access healthcare. Mr. Kofi emphasized that the scheme was designed as a district-wide mutual health insurance scheme, ensuring that citizens could have equal access without compromising on the quality of care. Inside the NHIS structure and funding. Determined to see the inner workings of the NHIS, Kwame visited the offices of the National Health Insurance Authority (NHIA). There he met Ms. Ifwa, a deputy chief executive who walked him through the structure of the NHIS. Our operations are divided into three administrative divisions, Ms. Ifwa explained. The administration and HR division has 5 directorates. The operations divisions has 7, and the finance and investment divisions has 3 directorates. We support only the district-wide or public mutual health insurance schemes, ensuring the system remains sustainable for all Ghanaians. Ms. Ifwa then detailed the funding mechanisms: 2.5% SNIT contributions, a percentage of workers' contribution, 2.5% VAT collected on selected goods and services, minimum premium set at 25 Ghana cedis per annum, parliamentary votes, annual budget allocations, support from health partners, contributions from donors and international organizations. She also discussed exemptions: children under 18, indigent, those over 70, and SNIT pensioners, all forming about 60 to 70% of the population. This large exempt group, while socially crucial, presented operational challenges for the scheme. On the ground, challenges faced by the NHIS. Eager to understand real-world impact, Kwame traveled to the rural clinic in the Volta region. Here, he observed both the strength and struggles of the NHIS firsthand. At the clinic, Nurse Ekia described some persistent challenges. For schemes, we see a growing number of enrolled members, but renewals are sometimes reduced due to delay reimbursement and weak claims management. Manual processes, errors in claim processing, and delays in ID card production all strain the system. For providers, unresolved accreditation issues and the pressure of prescribing outside for NHIS drug list add to our workload. There are also instances of unauthorized charges and unfortunately cases of fraudulent practices. For clients, some clients feign sickness to obtain medicine for themselves and relatives, or they might overuse services, which strains our resources. Kwame also learned about broader challenges: delayed reimbursement, leading to increased costs as suppliers raise prices, financial malfeasance, issues like ghost workers and fraudulent check practices have, in the past, undermined trust. Policy impact: new decisions such as facilities bearing utility costs and the implications of the Embarked Funds Capping and Realignment Act 2017 further complicate financing. Paving the way forward, innovation and restructuring. Not all news was gloomy. At the vibrant workshop in Accra, stakeholders from various sectors gathered to discuss the future of NHIS. Kwame listened intently as experts unveiled innovative strategies. We are moving towards computerizing front desk operations at providers to simplify membership identification, said Mr. Kwabna, an NHIS technical officer. Loans and grants are helping us network health facilities, and we are adopting standardized pricing system nationally, shifting from fee for service to diagnosis related group pricing. Other initiatives included mobile renewal services, launched in December 2018, allowing members to easily renew and authenticate their membership via phone by just dialing star 929 hash. NHIS 4 pillars restructuring. 1. Electronic claims management system. To enhance efficiency and reduce fraud, that is the first one. 2. Stricter clinical and internal audits to improve compliance. 3. Legal directorate. Strengthening legal oversight with a team of 6 lawyers. 4. Amendment of NHIS law, making fraud more punitive and redesigning financing for sustainability. Mr. Kwame also mentioned a pilot capitation payment scheme in the Ashanti region, a promising method to streamline payment and control costs. The World Health Organization had even remarked the African countries envy the NHIS but stressed that improvements were needed. A sentiment echoed by many experts. Reflections and the road ahead. As the sun set over Accra, Kwame gathered with his mentor and colleagues to reflect on his journey. He summarized his learnings: historical evolution, from free care at independence to token fees and cash and carry system, and finally to NHIS, a pro-poor intervention aimed at universal coverage. Structure and funding. The NHIS is supported by a blend of SNIT contributions, VAT, minimum premiums, parliamentary funding, and donor support, yet faces challenges with a large exempt population. Operational challenges: weak claims management, delayed reimbursement, provider accreditation issues, and misuse by clients with all required ongoing attention. Innovative solutions: the move towards digital systems, standardized pricing, and stricter oversight offers hope for a more sustainable future. Kwame realized that while the NHIS is a trailblazer in African health insurance, its continued success hinges on addressing these challenges through innovation, collaboration, and rigorous oversight. Returning to his lecture hall, Kwame was inspired by his journey. He transformed his experiences into a compelling lecture, blending rich historical insight, real world challenges, and forward thinking solutions. His story was not just about policies and figures, it was about people striving to create a healthcare system that leaves no one behind. And as he began his lecture with a quote from the WHO: African countries envy NHIS, but improvement is needed. Kwame knew that the conversation about Ghana's health financing would continue to evolve, driven by dedicated professionals and commitment to universal care. Through Kwame's quest, the tapestry of Ghana's health service finances came to life, reminding every listener that every reform, every challenge, and every innovation is part of a greater journey toward accessible, quality healthcare for all. Thank you for listening to Territ Podcast. Bye.